This is a woman who's a fairly young woman from Chinese descent who is a never smoker, and she has a fairly recent onset of pulmonary symptoms, cough, chest pain, and has had several years of recurrent bronchitis. But because of her new symptoms, presented to her doctor and underwent a chest CT where she was found to have lung mass as well as pleural disease, and she had a biopsy which showed lung adenocarcinoma, and a mutation testing was done, and it showed an EGFR mutation. What was interesting about that mutation is that it was an uncommon mutation. It was a G719X mutation. It was also negative for ALK as well as KRAS. Because this woman was a never smoker, one might think she's not at risk for lung cancer, but there are patients who've never smoked or have smoked a very small amount in the past who can get lung cancer. Much more commonly, patients who have smoked are at greater risk of lung cancer. But such as this woman, there are patients who've never smoked who can get lung cancer, and mutations such as EGFR are more common in patients who have never smoked. As I mentioned, what's interesting about this case is that she does have a rare mutation in EGFR, the G719 mutation. And so this mutation, while it is uncommon, we do sometimes see it in lung cancer, and it does lead to sensitivity of the EGFR inhibitor. So it is very important to note that that is present in her cancer. And so her cancer may have been able to be caught at an earlier stage if imaging was done earlier. What's challenging in patients like this is that they don't commonly undergo imaging, because if they have bronchitis or they have pulmonary symptoms, lung cancer is not usually on the forefront of doctors' minds or of patients' minds because they've never smoked. So it's not thought to be a possibility in patients like this. And actually that's probably for good reason, because lung cancer is not common in never smokers. So lung cancer screening can be done in patients, but again, not typically in patients who are never smokers because of the very low risk in those patients. The recommendations for lung cancer screening currently are patients who are between the ages of 55 and 80, who have a history of smoking 30 pack years or greater, and either are current smokers or have quit in the last 15 years. So those patients are those who are at the greatest risk of having a lung cancer, and that's why they're included in the recommendations. The reason that those patients are who is included is that there was a trial that looked at patients that fell into that group and screened those patients using a low-dose CT scan, looking for abnormalities, and it was found that if you did a low-dose CT scan, that you could find abnormalities that then potentially could lead to the diagnosis of lung cancer and decrease the risk of lung cancer deaths. And so that now is the recommendation, to screen patients with those factors. So you can see that this patient would not have fallen into that. She had no history of smoking at all. And so that's why she did not get lung cancer screening, and she only underwent a CAT scan once she developed symptoms.